Okay, so we will be conducting our William Patterson University Nursing Personal Clinical Experience video. I'm Ed Lasky, a nursing student, and with us we have here GK. GK, do you consent to be part of this educational video personal experience?
Yes.
Yes? Okay, very good, and so we will continue. So first we're going to do our head-to-toe assessment. Well, that's what we're doing, is a head-to-toe assessment. We start with the head and move down to the toes in a logical order. In the interest of time, we'll keep the video, try to keep it to 30 minutes. We have all our equipment lined up here, several different tools and supplies organized nicely. We'll be conducting a head-to-toe assessment, like I said. And okay, GK, are you ready? Are you comfortable?
Yes.
Okay, very good. So first of all, we're going to start off with a general survey. I'm just going to be observing the patient. Appearance is appropriate for his age. He is alert, cognition. What are your initials?
GK.
Okay. Do you know the date?
That's 27th of June.
Okay. And do you know what time it is, or approximately?
The afternoon, maybe 3:30.
Okay. Very good. I'm also noting facial expression, and mood and affect are appropriate. Speech is appropriate. Hearing, no problems, normal. Personal hygiene is appropriate. No skin odors. Skin color is even tone. Nutritional status is appropriate. In skin turgor, we check the skin turgor. We just pinch, tent the skin, and it folds back elastic, so there's no dehydration. And your latest BP today that we just took was what?
105/67.
Okay, very good. Appropriate normal findings is what we have. Then the next thing I'm going to do is inspect the head and face. I'll be examining the scalp, palpating the scalp, hair and cranium. Skin turgor we did. Okay. Scalp, hair, cranium. Cranium is round, proportionate, and smooth, and symmetric, and no tenderness. So, I'm just going to palpate gently. No tenderness, right?
No.
Okay. Very good. Next is inspect the face. The face is symmetric. Expression, features are appropriate. Palpate the temporomandibular joint. And I'm going to ask you to open and close your mouth, and it should be even and smooth, no tenderness, no pain, no clicking. So I'm going to palpate here. Now just open and close your mouth, and close. Very good. That's a normal finding. Okay, next, to test cranial nerve 5, the trigeminal nerve, I will palpate the muscles of mastication. So we have the temporal muscle. Sorry, excuse me as I change my glasses. So the masseter and temporal muscle, while the patient clenches and relaxes his teeth. So this is going to test cranial nerve 5. So first we do the temporal muscle. Okay, clench your teeth. Very good. Again. And clench and relax. Good. Okay. Perfect. Normal finding. Okay. So, while the patient, we did that already. Okay, that's the teeth. The finding is the muscle should feel equal on both sides, which it is, and that's the result. Next, to test cranial nerve 5 sensory function with the patient's eyes closed. You're going to say now when you feel a cotton wick on, on your face, forehead, cheeks, and chin.
Okay.
Okay, so I have to go through those 3 areas. All right, you could close your eyes now and tell me when you feel something. Just say now.
Now,
Okay?
now, 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 now.
Okay, very good. The normal finding is when the patient feels the cotton wick, which he did. Next, to test cranial nerve 7, noting symmetry as patient raises eyebrows. Okay, GK, raise your eyebrows. Very good. Smile. Excellent. Frown. Okay. Show your teeth. Open your eyes wide. Good. Now, if you could take your glasses off, because I want you to close your eyes, and then I want you to open your eyes against resistance. Okay, very good. Those are all normal findings. Next, we're going to look at the eyes. We're going to test corneal light reflex. That's the Hirschberg test. Using a pen light. We're going to shine the light in the patient's eyes with a pen light. The light reflection should be equally relative, the exact same spot in both eyes. Okay? So, all right, just you could look straight ahead out my nose, and it is. It's the light reflection is equal on the same exact point on each pupil. So there's the test is negative for dissymmetry, which means we have symmetric eyes between both pupils. The result is no uneven gaze between both eyes. That's what we were just checking with that. Next is cover, uncover eye test. I need you to stare at an object. I don't know, maybe that cup over there. I will cover and uncover one eye. Well, you can look at my nose even. Just look at my nose. I'm going to cover and uncover one eye a few times. Okay, so let's do that. Okay, just look straight ahead. I'm going to cover. Now the other side. Okay. If no movement occurs in the uncovered eye, the eyes are aligned. So we're testing for eye alignment with that. It tests for extropia, etc., which is not the case here. The next test is extraocular movement. Now this is going to test cranial nerve 3, 4, and 6. Okay, so I need you to follow my finger. Only your eyes now. Don't move your head or your face. Now, okay. Actually, yeah, you can follow my finger. So now we're going to do this slowly. Just watch my fingertip. And what we're looking for here is equal symmetric movement, what we have. Okay, very good. Did you have any double vision while you were doing that?
No.
Nothing not unusual with your vision. Okay. This tests the ocular nerves and ocular muscles. Eye movement should be symmetric in both eyes, which it was. Equally positioned and aligned. Next, we're going to inspect eyelids, eyelashes, inspect lacrimal appomatous and conjunctiva, and inspect sclera. Okay, so I'm gonna just gonna lift your okay, good, down. Okay, very good. So what we want to see is everything has to be symmetrical, which it is. Sclera is pink and moist, and no lesions, no swelling, no discharge, or anything unusual like that. Okay. All right, so we did the eyelids, eyelashes. Okay, very good. Next is going to be PERRLA, other known as Perla. Pupils are equal, round, and reactive to light with accommodation. So the accommodation part's going to come as a separate. So this is going to test cranial nerve 3, is what it's testing. So just look straight ahead. I'm going to shine a light in your left eye and then in your right eye. Okay, so just look straight ahead at my nose. Alright, so I'm going to do that one more time. Okay. Alright, so what I was doing there is I was watching the pupils constrict with the light. First I checked the left and the right, and then I checked the left and the right again, but I looked at the opposite eye and both pupils were equal, round and reactive to light. So they should be both symmetric like that. Now we do accommodation. I'm going to hold a pen, about maybe a foot away, and you could just look at the. Actually, I want you to look at that cup up there. Okay. Now I'm going to put this in your. Now I want you to shift your focus onto the tip of this pen. Now go back and look at the cup. Good. Now look back at the pen. Okay. So when I noticed that when you were looking far at the cup, your pupils dilated, and then when you looked back at something close, your pupils constricted. So that's the accommodation part that we tested. So that's a normal finding. Next is the fundoscopic assessment with an ophthalmoscope. So now if we could just darken the room a little bit, if it's possible. That's good, this way I can see, not too much, a little bit, yeah, a little bit up. Yeah, that should be fine. That's good. So this is the fundoscopic assessment with an ophthalmoscope. So we darken the room. All right, so I want you to look at a distant object. This is going to help you dilate your pupils. All right, so now I'm going to go 15 degrees lateral with the ophthalmoscope in my left hand dialed to 0. So at 15 degrees, I'm going to see something called a red reflex. All right, so just look straight ahead. There, I see it there. There it is. Okay. All right. Now I'm gonna look into your eye, and then I'm gonna explain the findings that I see. You okay?
Mm-hmm.
Okay. You okay?
Yeah.
Yeah. I didn't know. Sometimes the bright lights are
No.
bothersome. Okay. So what I was able to obtain was a red reflex. It's a red glow that's seen. Normal is no opacities. It's just a normal, nice red glow. The you noticed I moved in closer, inspecting the ocular fundus. The optic disc I saw should be creamy, yellow, and round. The physiologic cup is brighter and be more than half the diameter of the optic disc. The background was clear, no lesions, and a reddish color. I noted the retinal arteries and veins. Arteries should be thinner. The vessels become thinner to the periphery, and no lesions, and no tangled vessels or anything unusual. Okay, so let's bring the light back so we can see a little bit better. Yeah, let's get that one too, just so we can see a little bit better. Okay, eyes. Continuation of what I was just talking about. I was able to see the macula, which is darker, and it's 2 disc diameters, temporal to the optic disc. I'm sorry, I have to look at the other eye. I have to do the same to the other eye, I'm sorry.
Show them both of them?
Yeah, if we can.
That's the mask.
Yeah. Even if we could just go halfway, man. That's fine. Okay, so the right eye, use the right hand. Okay, I'm gonna go lateral. Just look straight ahead. Yeah, look straight ahead on an object. And there. Okay, that's the red reflex. Okay. So the same findings in the right eye as in the left eye. Okay. Sorry about that. We have to, yeah, just make the light come back again.
That's good.
Okay. So we had a normal finding of the retinal background. Okay, next is ears. So if you can turn your head, just so I can look at your ear, I'm inspecting the external ear, and let me see the other ear. They are equal, no lesions, no redness, no discharge. If I touch your ear, any tenderness?
No.
Any tenderness?
No.
And they should feel firm like that. Tragus and the pinna. Okay. So symmetric in size, shape. I palpated the pinna and tragus, felt firm, and there was no tenderness, no pain. Palpated, and I have to palpate the mastoid process, which is right here. Any tenderness or pain?
No.
Okay. Very good. Okay. Okay, so now with our otoscope, I'm going to be pulling the pinna up and back, and then I'm going to do an inspection of both ears this time, both sides. Okay, so this is our otoscope. All right. I'm going to be pulling up and back. Just look in the ear. And then to the other side. Up and back. Very good. Okay. So I looked inside of both ears. I inserted the specula. The ears were patent, no redness, no foreign bodies. I was able to look at the eardrum, and it was shiny, gray, and translucent. The light reflex appears in the anterior inferior quadrant. The umbo, manubrium, and short process are also seen. So that's normal. And then there was no perforations or anything abnormal. Next is the whisper test. This is for hearing acuity. Okay, so what I want you to do is, actually I can, so this is going to be the whisper test first of all. So what I'm going to do on the opposite tragus, I'm just going to push rapidly and whisper a two-syllable word in the right ear as I push on the tragus on the left side. Alright, so I want you to repeat the word after I say it, alright? It's going to be a two-syllable word.
Okay.
Alright, ready?
Airplane. Airplane.
Armchair.
Armchair.
Okay, good. Now we could do the other side, same thing. Airplane.
Airplane.
Armchair.
Armchair.
Okay. All right. Okay. Next is going to be the Weber test. We're going to use a tuning fork on the top of the skull, and you should hear the tuning fork in both ears, and they should be equally loud. Let's just see. Okay, I'm going to strike the fork, and then you can just. Did you hear it? Or no?
No, not now.
No? At first, did you hear it?
I heard it, yeah. Yeah,
Did you hear it in both ears?
yeah.
Okay.
Yeah.
All right. All right. Very good. That's a normal Weber test. Like you said, you heard it in both ears equally loud.
Right.
Okay. So now we're going to do air and bone conduction. So air conduction should be twice as long as bone conduction. So the tuning fork, I'm gonna strike the tuning fork, and then I'm gonna put it on your mastoid process. And then I want you to tell me when you don't hear it. Okay.
Now.
Okay. Now I'm going to place it just in front of your ear, in the air,
Okay.
and then you tell me when you don't hear it. Can you hear it?
Yeah.
Just stop.
Now.
Okay. All right. You see.
Wow.
So yeah. So that's exactly the result we want. The air conduction is at least twice as long as the bone conduction. So we're going to do that on the other side. So I'm going to strike the fork. I'm going to put on the mastoid process on the bone. Wait, hold on. Give it a good strike there. Tell me when you don't hear it.
Got it.
Okay. All right. So now we're going to do air conduction. And again, that should be at least twice as long.
Gone.
All right, that's definitely maybe 4 times as long, but it's definitely greater than the bone conduction, but that's the result we're looking for. Okay. All right, that's the Weber, and that was called the RIN test. All right, so that's the hearing, and we move on to the nose. So I'm just inspecting the nose, just looking. First of all, as inspection, I'm looking at the shape of the nose. The nose is midline. It's it's symmetric. No lesions on the skin. If I palpate the bridge, there shouldn't be any tenderness there on either side or on the bridge. I'm also going to palpate the frontal and maxillary sinuses. There should be no pain or tenderness. All right, so I'm going to, this is the frontal sinuses. Here we go, those sinuses. No pain or tenderness?
No?
Okay, all right. Very good. That's the sinuses that we just inspected. Another normal finding. That was the frontal and maxillary. All right, so now we're going to check nasal patency. I'm just going to hold one side of your nose down, and I want you to breathe in and out. Okay. Now the other side. Breathe in and out. Okay, so both nares are patent, and you're getting air on both sides. The airflow is normal, and that's a normal finding. Next, I'll use the otoscope to inspect the nasal cavity. The nasal septum and the turbinate. So what I'm looking for is no deviated septums, no swelling, discharge, or reductions in space. Normal is smooth, moist, and red. Okay, it's pink, moist, and red on both sides. Okay. That's the normal finding. That was inspecting the nasal cavity. Normal, smooth, moist, and red. Next, we're going to test cranial nerve 1. This is for the sense of smell. Okay, now I will ask you to tell me what you smell with your eyes. You're going to close your eyes, and then you're going to tell me what you smell. All right, eyes closed. I'm gonna put this in front of your nose, and you tell me what you smell.
Orange.
Orange? Okay. Orange it is. We could do one more. We have another one here. Tell me what you smell.
I guess peppermint or spearmint.
Peppermint or spearmint? Okay, like a mint. Okay.
Yeah.
Very good. Okay, so that's a normal cranial nerve number 1 test. That's normal. Okay, next we're going to move on to the mouth and throat. We're going to retract the lips and tongue. Normal is going to be pink, moist, and smooth, and symmetric. No lesions, no cracking, no odors. All right, so just open your mouth. I'm just going to check it. Yeah, perfect. All right, I'm just checking the lips. Okay, all right. Now I'm going to inspect the the buccal mucosa in the mouth and the gums. Inspect teeth. Should be white, evenly spaced. Mucosa should be pink and moist. Teeth, upper teeth should not. Upper teeth should rest on lower teeth and overhang slightly. The tongue should be pink and moist. All right, so if you open, say ah. All right, I just want to get my pen right so I can take a look in here. Okay, very good. All right, I see the uvula is midline, and we'll go into the other structures shortly. Very good. All right, that's all right. Okay. All right. Can you lift your tongue to the top of your mouth? You can see some vessels, no lesions, or anything unusual. Okay, you can close your mouth now. Just there for a second. Okay, so we inspected the tongue. We checked the tongue, the sides of the tongue, the teeth, buccal mucosa, everything's normal there. No white patches, no induration in the mucosa. The tongue is pink and moist. Okay, and the bottom of the tongue was normal, smooth, moist, no ulcers. Okay. Next, I'm going to shine a pen light. If you open your mouth again, I'm going to shine a pen light at your hard palate, the transverse rugay. All right, open. Yeah, put your head back. Perfect, okay. Looking at the hard palate and the soft palate. The soft palate moves up and down. The tonsils are pink, rough in appearance, and the tonsils are +1 size. The uvula, like I said, was midline, symmetric. Okay, uvula and soft palate, they rose. All right, now I want you to, I just want you to say ah. Yeah, good. So yeah, the uvula and soft palate, they did rise. Okay, cranial nerve 12, tongue movement and tongue strength. I need you to stick out your tongue. Stick out your tongue, good. All right, now I want you to push against this, the stick with resistance. Okay, very good. All right. Okay, and then can you lift up? Down. Okay, perfect. Okay, so that's tongue movement and tongue strength. That's a normal finding for a cranial nerve 12 test. Cranial nerve 9 and 7 is taste. I'm just going to ask you, do you have any alterations or reductions in your taste?
No.
If you did, that would signal a problem with cranial nerve 9 and 7. Cranial nerve 10 is the swallow and gag reflex. All right, so just put your head up. I'm going to ask you just swallow. Okay. I'm not going to initiate the gag reflex. I would have to put the tongue blade to the back of your throat, and I don't want to torture you, but I'm going to ask you a question. When you brush your teeth, have you ever gone too far back with the toothbrush and then gagged?
Yeah.
Well, that's the gag reflex, and that would be testing cranial nerve 10. So next, we're going to move on to the neck. I'm going to be palpating the lymph nodes in your neck. Now, they should not be enlarged. They should be soft, small, no greater than 1 centimeter, and movable. The pre-auricular, submandibular, etc. I'm going to be using a circular motion with my fingertips to check the lymph nodes. Okay? Yeah, okay. Then we move down a little bit, we got more lymph nodes, clavicular lymph nodes over here. And I'm not feeling anything that's enlarged. Okay. Okay, so that's a normal finding in our lymph nodes, nothing enlarged. And then as I'm looking at the neck, I'm not seeing there's no pulsations, so that's a normal finding. I'm going to assess the tracheal position. The trachea and sternomastoid muscle should be symmetric on both sides. So if we got our trachea here, I start off here, and then I'm feeling on both sides of the trachea, and it's symmetric on both sides. Okay, so next I need you to take a small sip of water, and I want you to put your head up so that I can see your throat when you swallow. So I'm taking note of the throat. You can swallow. Okay. Okay. Very good. That's normal. I could see it rise and fall. That's a normal finding. All right. So now I'm going to palpate the thyroid. So I need you to just tilt your head forward and slightly to the right, like this. That's good, like that. Okay. I want you to take a sip of water and just leave it in your mouth, and then I'm going to ask you to swallow, but don't swallow it yet. All right, so I'm going to feel on this side, both sides of the thyroid. Okay, so swallow. Okay. All right, so I felt the thyroid. Okay. Okay. All right. Okay. So all right. So yeah, the thyroid moved upward with the trachea and larynx. So now we got to do the left side, the other side, the right side. All right, so just do the opposite. If just take some water in your mouth and just don't swallow it yet, and then put your head down and then slightly to the, I guess it would be a left. All right, so feel on the sides. Okay, so you can swallow. Okay. All right. All right. Okay, so the same finding on that side, on both sides. Nodes, we got the tracheal position, the tracheo-sternomastoid muscle. The trachea and sternomastoid muscle are symmetric on both sides also, if I didn't mention that yet. I'm also going to palpate the carotid pulse. both sides. So it should be equal bilaterally, which it is. No, and no pulsations. Okay. I assessed the tracheal position. We palpated the thyroid. We observed the thyroid and trachea and larynx. Now I'm going to auscultate the thyroid with the bell of my stethoscope. Do I have my stethoscope here? Here it is. Okay. All right, so I'm going to auscultate the thyroid with the bell. So I shouldn't hear any bruits. If the thyroid is enlarged, I would hear a bruit. Okay, I'm gonna use the bell. Yeah, and just, don't breathe. Okay, good, no bruit. I also have to auscultate the carotid arteries. Good, no bruit. And the other side. Okay, good, no bruit on either side. Next is the posterior chest. We're going to, posterior meaning that's the back. We're going to check just the general condition of the skin, no lesions. In the thoracic configuration, which is symmetric. It's going to look at the back. Everything is symmetric. No lesions, even skin tone. No injuries or anything of that nature. The thoracic expansion, if you could just move up just a little bit. So what I'm going to do is I'm going to put my palms on your back, and my thumbs are going to be together. If you just, or if you just sit forward, like move up a little bit. Okay. So there, put my thumbs together. Now I want you to take a deep breath. Good. I see. So my thumbs are moving apart, which is a normal finding. We want to see the lung expansion. So that's the posterior chest thoracic expansion. The thumbs came apart. So normal thoracic expansion. Next is tactile fremitus. So I'm going to ask you to say 99, and I'm going to place my palms on your back, and I should feel the vibration from you saying 99 equal on both sides. Okay, so, all right, say 99.
99.
Good.
99.
Good. Again.
99.
Perfect.
99.
Okay. All right, so that's good. Tactile fremitus is equal on both sides. So now I'm going to palpate in the posterior lung fields, just palpate the skin. No masses. I'm not feeling any bulging or anything unusual. Then I'm going to percuss. I'm going to start at the lung apices. So over the lungs, I'm going to hear it produces resonance. Over the visceral, it's going to be more dull. But no matter what, it should be symmetric. All right, so I'm going to start to percuss. Alright, so that was equal bilaterally. Sound was symmetric. Next is going to be diaphragmic excursion. So I'm going to ask you to exhale and hold it. But I'll let you know when, okay? Then I'm going to quickly percuss down the scapular line. So I should be hearing resonance to dullness. So I'm going to put a little mark on this spot. So I'm going to let you know when to take that breath. Okay. All right, stop the pen here. Okay. All right. So now I want you to exhale and then just hold it. Okay. Ready? Go ahead. Exhale. Okay. So that's the spot right there. Make a little mark there. Now, all right. So that mark is that spot is marked. Now I want you to take a deep breath and hold it. Then I'm going to percuss down from that first mark I made until the sound changes from resonance to dullness, and then I'm going to make another mark. All right, so go ahead. Okay, right there. Okay. Okay. So normal is between 3 and 5 centimeters, and we have 4 centimeters here. That's on the left side, but I have to do the other side as well. And they should be equal bilaterally. All right, so I'm going to ask you again to exhale and hold it, and then I'm going to quickly percuss down from the scapular line. All right, ready? Okay. Okay. There. And make a mark on that area. All right. All right. So now take a deep breath and hold it. Then I'm going to percuss down from that first mark until the sound changes from resonance to dullness, and make another mark. Okay. So go ahead. So right there. Okay, so both sides are equal, equally symmetric. That's a normal finding. That's what we want to see. Okay, we did both sides. So now I'm going to auscultate lung sounds, bronchovesicular lung sounds on the posterior. Starting on the upper back. Then I'm going to move downward. I'm going to be listening to vesicular sounds elsewhere. So this is going to be lung sounds on the posterior. Just want to make sure I'll put it here. That's okay. All right, take a breath. In and out. Just breathe normally. In and out. Breathe in and out. Again. 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 Okay. All right. So that was the posterior lung sounds. Now now we move on to the anterior chest. We're going to inspect the skin. We're going to note even tone. Again, no lesions. Shape is symmetric. The respiratory rate is the patient's breathing comfortably. Respiratory pattern, the patient is breathing comfortably, even and easy. Just by watching the chest rise and fall. So anterior thoracic expansion. So I'm going to use the same maneuver with my thumbs together on the front of the chest. And then all right, so take a really deep breath. Okay, good. So my thumbs came apart. Good. So we have normal lung expansion. Okay. Even and easy. All right. All right. So now we're going to do lung sounds anterior. That's the front. All right. All right. Breathe. In and out. Breathe. In. Breathe. Good. Breathe. Okay. Okay. All right, good. Okay. So we have clear breath sounds, no crackles or anything unusual. We have clear sounds there. All right, so next we move on to the heart. We're gonna auscultate the heart sounds. We're gonna do aortic. I'm gonna go through them one by one. So we're gonna do different areas of the heart. Okay, just shut up. Okay. All right, so we're gonna do aortic. Just breathe normally. And then pulmonic. Erb's point. That's at the third rib. Tricuspid. That's at the fourth. And mitral. That's at the fifth. Okay, we have normal heart sounds. I'm hearing S1 and S2, no S3 or S4, no gallop, no friction rub. Okay, next, in order to assess JVD, in the interest of time, we don't have an examination table. So what I would do is I would hold a ruler vertical on the sternal angle. Then I would hold a straight edge perpendicular to the ruler and read where they intersect, and it should be 2 centimeters or less. If it was more than that, then we would have jugular venous distension. Okay, so next is inspection, auscultation, and palpation of the aortic, renal, iliac, and femoral arteries. So, all right, if you could just lift up your shirt. All right, so I'm just looking. So the aortic is in the front. We have the renal here. The iliac is just a little bit lower, and then the femoral is a little bit lower yet. That's I was just inspecting it. Next, I'm going to auscultate those areas. Again, there shouldn't be any bruits. That's the renal, it's the iliac, and then the femoral is just a little bit lower yet. All right, so no bruits. JVD. So that was inspection and auscultation. So now we can palpate those same areas. Just lightly palpate. That's the aortic. That's the renal. And we got the iliac. And then the femoral just lower yet. That's those arteries. So, and now to inspect and palpate the upper and lower extremity pulses. So this is going to assess circulation. All right, so we're going to do the brachial pulse here. We're going to do the radial pulse here, and the ulnar pulse on the opposite side. Those are all arteries. So we're going to do brachial, do radial, and ulnar arteries. So they were all symmetric equally on both sides. Next, we're going to move on to the pulses in the leg. So in the leg we have the femoral. So that's here. Femoral on both sides. Then we have the popliteal. That's behind here. Let me check the other side. Okay, good. We did the popliteal. Now we're going to do the dorsalis pedis. That's on, if you could just take off the slippers. And that's on top of the foot here. Dorsalis pedis. Good pulses there on the right. Good pulses on the left. And then we do the posterior tibial. That's behind the medial malleolus. The right is good. The left is good. Okay, next is the abdomen. First we're going to inspect the abdomen. Just look up your shirt a little bit. Just look at your stomach. Okay, so there's no distension upon inspecting. The next thing I'm going to do is auscultate for peristalsis in 4 quadrants. Just going to move through systematically. Move over to the left upper quadrant. I'm hearing normal active bowel sounds. Left lower quadrant. And then finally the right lower quadrant. I'm hearing normal active bowel sounds. Okay, so next I'm going to put the belt of the stethoscope over the aorta. Again, I should hear no bruit. Renal arteries. No bruit. Iliac. No bruit. And then femoral is lower yet. And no bruit. Okay, you can cover up. Alright, so we just checked those arteries. The femoral artery, that was the last one we did. That's in the lower abdomen. Next is to percuss all quadrants of the abdomen. So we're gonna percuss. So when you're over an organ like the liver, it's going to sound more dull. and when you're over the bowels, it's gonna be a different sound. It's not gonna be as dull. So that's the percussion. Okay, that way you just percussed all the quadrants. So now I'm going to use light palpation. Light palpation is touching only 1 centimeter, pressing downward. It's just, you're just feeling the surfaces, knowing the circular motion. I'm not feeling any bulges or anything uneven. Everything is symmetric on light palpation. And then deep palpation, I mean, it could go up to 8 centimeters. I'm not going to go that deep, but it's just a little bit deeper. And as you're doing this, what you want to do is try to visualize the organs. This way, it's more meaningful. You actually know what you're looking for. And then on this side is the liver. So you want to feel under the rib cage. Just like a light palpation. Usually don't have to go too deep. I can feel it there. Alright, so that's the abdominal palpation and deep palpation. The spleen and the kidneys are usually not palpable, but it's a little bit more difficult to do them. And then we move on. Okay, so now we're going to do upper extremities. We're going to inspect the clavicles, and so just inspecting the clavicles, and then the scapula from behind. Everything is intact, symmetric. Shoulders, the same thing. Everything is intact, symmetric. And palpate the joints. Any tenderness in the joints? No. Next is the range of motion and strength in your neck. If you can push against my hand to the left. Okay. Now to the right. Okay. And then if you can put your head, just put your head forward. Put your head forward down. Right, good. All right. All right. So that was the range of motion and strength. Can you turn your head left and right for me? Left and right. Okay. Good. Shoulders. Can you lift your shoulders up? Good. Okay. And then elbows. Any pain in the joints or anything?
No.
You're able to curl your arms? Okay. Can you raise your hands above your head? Okay. All right. Okay. And that's normal. Shoulder, and then the elbows. Okay, so now we're going to do the reflexes. So we're going to do the biceps. All right, so that's going to be here. Biceps. Okay. You feel it?
Mm-hmm.
Okay. All right, so that's the biceps. Now with the triceps, we just want to let the arm hang. I'm going to strike here, right on the tendon. Okay, I saw a move.
Yeah.
That was that. And then next is going to be brachioradialis. All right, so that's going to be right here. See that? It moved. See that?
Yeah.
Uh-huh. So that's a brachioradialis. That's a normal finding. So we could do the other side now. Bicep. A little flinch, right?
Yeah, yeah.
Alright, so here, I'm gonna do the tricep. Right? Yeah.
Yeah.
Okay. Now we do the brachioradialis. It did flinch.
Yeah.
I felt it. Okay, so now we're going to inspect and palpate the hands. So we're gonna inspect and palpate the hands. Everything is equal and symmetric. Can you just gently squeeze my fingers? So we have equal strength in both hands. Can you just lift your hands up against resistance? Or your wrist? Yeah, okay. All right, so we did the wrist, and now if you could just raise everything up. Okay, good. All right, and then down. Okay, and then forward, and then back. Okay, good. Okay, so we got good range of motion. Range of motion and strength, hand and wrist, we did that. The hips, palpate range of motion. If you can lift your leg up as I'm palpating your hip. All right, and lower your leg, and on this side, and lower your leg. Okay. Any tenderness or anything in the joints? No? Okay. Good. Now we move on to the lower extremities. We're going to inspect and palpate lower extremities. The knees, range of motion again, which we just did. If you could bend your knees, and then lift your leg at your hip joint, and then move your ankle up and down. Same thing on the left side. Range of motion, strength, inspecting, palpating the ankles and feet. Okay, good. Other side. Inspecting, palpating ankles and feet, range of motion and strength. Palpate the pulses. And so we have to do the Achilles reflex. So that's behind the foot, the Achilles reflex. Just gonna tap a little bit. Here, and here. Okay,
Okay.
there we go. Yeah, I saw it. So that's the Achilles. And then besides the Achilles reflex, we want to do the plantar reflex. We also have to do the reflex in your knee. That's the patellar reflex. All right, so we're gonna just. Okay, I saw that one. Okay, so we have good patellar reflex. Pulses, Achilles, and now we have to do the plantar reflex. That's going to be next. So if I can see your foot. Now I'm just going to gently rub this Q-tip stick up the bottom of your foot. So we shouldn't see anything. We shouldn't see any movement in your foot, in your toes. That would be like, yeah, that's fine. Yeah, your toes didn't curl or nothing. In a 2-year-old, that would be normal, but in adults, it's not normal. So we're going to check this side, plantar reflex. Good, okay. No movement. Okay. I know it's not the most comfortable thing, but there was no reflex movement. So that's normal. All right, next, we're going to check, let me see, supine. We're going to check posture. GK, if you can stand up, I'm going to palpate. I'm just going to touch your spine. Palpate the spine. Any tenderness or anything there?
No.
Everything feels like it's in alignment. It's a straight, just symmetric midline. Okay, that's palpating the spine, spinal column, and the. Okay, so now, if you could bend down and touch your toes. We just want to make sure your back has strength. Okay, you can go up. Now, if you can lean back. Okay, and then straight up. And now, if you can twist at your. Oh yeah. Okay, good. So we have good range of motion there with the spinal column, and the muscles. Next is going to be neurologic cranial nerves. Cranial nerve 1, identify odors. Now I know we already did this one. We already identified a normal cranial nerve 1. Cranial nerve 2 is optic. So what we're going to do is visual fields. So I'm going to cover one eye, And then you're gonna tell me when you see my hand come into your view, okay? You're just gonna say now, okay?
Now. 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 Now.
Okay. And the other side. You're gonna tell me when you see my hand come into your view.
Now. 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 Now.
Okay, that's good. So that's the visual field test. That's cranial nerve 2 to optic nerve. If you can look at the Snellen eye chart here, and what's the lowest line you can read?
Oh, LPFPH.
Okay. 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 Very good. 2020. Okay. Visual fields. Next is going to be cranial nerve 3, 4, and 6. Extraocular movement. We already did that one, but we could do like the 6 points of gaze. If you look at my finger, I'm going to do just follow the finger. Just your eyes. Okay, that's all 6 points. Very good. And the eye movement was symmetric, no nystagmus or anything unusual. All right, we already did the perla with the pupils equal, round, reactive to light and accommodation. We did that already. What we could do is all right. So blink. Okay, good. All right, next is cranial nerve 5. That's the facial sensation. We already did that. All right, if you close your eyes, what do you feel? Is it soft?
Soft.
Okay. All right. What do you feel? Is it more sharp?
Yeah,
More sharp? Okay. And then if you do, is it sharp, dull?
a little sharp.
Okay. All right, I'll take it. Okay. Good. Facial sensation, masseter and temporal muscle movement on strength. All right, if you can just clench your teeth. We did this one already. Again, clench your teeth again. Okay, good. It's the muscle movement is equal on both sides. Cranial nerve 7, facial movement. We already did that. We went through the eyebrows, the smile, all of that stuff was normal. Cranial nerve 8, hearing acuity. We did that one with the whisper, VIN and RIN tests. Cranial nerve 9 and 10, palatal movement and swallowing. We did that. Cranial nerve 11, trapezius and sternocleidomastoid. So I'm going to inspect your neck, and then I want you to shrug your shoulders against resistance. All right, just lift your shoulders. Good. Okay. Now again, move your head against resistance. Good. And then the other side. Good. Okay. So that's good. Normal findings. Movement and strength. Cranial nerve 12. Tongue movement and strength. We already did that when I used the tongue blade against your tongue with resistance, and you were able to stick out your tongue. So we already tested that cranial nerve. Next is going to be RAM heel to shin test. So I want you to do this. I want you to take your heel on one foot and then run it up and down the shin on the opposite leg, just up and down. And that's what we want to see. We don't want to see any extra movements off to the side or anything. All right, so you did both sides. Very good. Next is going to be exteroceptive sensation. So we're going to do hot and cold, sharp and dull, and vibration. All right, so if you close your eyes, you're gonna tell me, do you feel, is this hot or cold?
Warm.
Warm? Okay.
Feel warm.
Warm, okay. All right, it's
It's cold.
cold,
Cool,
okay.
yeah.
Cool, okay. All right, so that's temperature. Now we're gonna do, you tell me if it's sharp or dull.
It's sharp.
Sharp, okay. Where do you feel this?
My knee.
Your knee, okay. All right. And then also vibration. The vibration in. You feel that?
Yeah.
Feel that?
Yeah.
Okay, so we have hot and cold, we have vibration. We did sharp, dull, and soft. Okay, you're opening your eyes now, sorry. All right, next, superficial pain. Yeah, again, we did that with the sharp stick. Temperature. Next, proprioception. Fingers, toes, wrist. So what we're gonna do. Now, I want you to tell me if, all right, put out your hands. I want you to tell me if I'm moving your finger up or down.
Up,
Okay. All right, what about now?
down,
Okay. What about now?
down,
What about now?
up.
All right, with your foot,
Yeah.
up, okay. What about now?
Down.
Down, okay. So that's a normal finding. Cortical sensation, sterogenesis. Okay, so I want you to close your eyes and then put your hand out. I'm going to put an object in your hand, and just by feeling it, I want you to tell me what the object is. All right, close your eyes. All right, and then just raise up your palm. I'm going to put an object. Now you can feel it, and you tell me what is the object.
Key.
Very good. Okay, I'm going to have do your left hand now. Keep your eyes closed. I'm going to put an object in your left hand. You'll tell me what it is.
Like a coin.
A coin. Okay, very good. All right. So that's the key and the coin. Sterogenesis, normal finding. Gravesthesia. All right. So now put up your palm. Now I'm gonna with the wooden stick on this Q-tip. I'm gonna draw a pattern. I want you to tell me what that pattern is. Okay. So I'm gonna.
8, figure 8.
Figure 8. Okay, very good. And then on the other hand, you can try that. I'm going to draw pattern on your other hand.
Same thing.
Figure 8. Okay, 8 it is. Very good. So that's a normal finding. Sterogenesis, gravesthesia, writing, touch. All right. So next, we're going to do 2-point discrimination. So I'm going to touch your skin at 2 points, and I'm going to ask if you feel 1 or 2 points. Okay. So I'm gonna touch 2 points on your skin. I'm gonna touch 2 points. You tell me if you feel 1 or 2 points.
Now 1.
You feel 1 or 2?
2.
2, okay. Alright, how about now? Do you feel 1 or 2?
1.
1, okay. Alright, so that's a normal test. That was 2-point discrimination. Extinction, touch both hands. I'm going to touch both hands, then one at a time, ask to identify what hand is being touched. Alright, so I'm going to touch both hands, then I'm going to touch one hand. Which hand am I touching?
Left.
Okay. What am I touching?
right,
And one more time.
right.
Right, okay. Okay, that's extinction. Next home stretch here. All right, so now I need you to stand up. If you could just walk around here in like a small circle, just so I can observe your gait. Now if you can walk on your heels. Okay, good. And then walk on your tiptoes. And then walk heel to toe. Okay, good. Now if just stand right there and close your eyes. Do you feel dizzy or anything?
No,
No? Okay, good. Okay. So that's a normal finding. There was no swaying movement, so that's a normal result. Pronator drift. Now I need you, okay, so sit down. I want you to extend your arms out, straight out, okay? Then turn your palms up and close your eyes and keep it like that for 20 to 30 seconds. There should be no drift or movement. Okay, good. All right. So there was no drift or movement. That's a test for upper motor neuron lesions. Anyway, we had normal finding here. Okay. All right. And that, I believe, concludes our examination.